Good morning, everyone. It is Wednesday, December 23rd. My name is Pat Lopez, Science Department Chair here at NPC and a biology instructor, and I'm back again this morning with Dr. Susan Hoffman. Good morning, Susan.
Good morning.
Today we're tackling an important question, and it's I would say, Susan, that it's more a concern than a question, but it's one that a lot of people have, and that is, given that this is a new vaccine for a new illness, I'm concerned about the long-term consequences potentially of the vaccine, adverse consequences. So why don't you tell us, whether you share those concerns, Susan, and maybe why or why not?
Well, no, I don't share those concerns. But I do understand the concerns. And there are good reasons to, ask these questions.
For sure.
Because it is an emergency application.
Mm-hmm.
Normally vaccines, it's not, they don't go into production and use with an emergency order. This is an emergency. We're in a pandemic.
Mm-hmm.
Hundreds of thousands of people are dying.
Right.
And the clinical trials that they did had about 80,000 people in it. That's the largest clinical trial of a vaccine in history. And then through the clinical trial, and as the clinical trial wrapped up, the Food and Drug Administration did reviews. There is an advisory committee of immunization applications. They reviewed the data, and then they approved this emergency vaccine. Now it's still we're still collecting data. But over 1.5 million people have been immunized with it.
1.5 million to date.
1.5 million to date.
That's really impressive. So
yes.
We're not going to talk about the, adverse reactions that are acute, that occur right away. But again, why do you not have concerns about like the long-term, potential long-term effects of this?
From a immunologist standpoint, and vaccines have been around for, officially in the 20th century, but longer than that.
Right.
When in medicine, we compare the risk-benefit ratio, the risk for immunization long-term is small to almost nil. They almost never talk about long-term consequences.
Because there really aren't any, right, that we know.
There really aren't any.
Right.
There really aren't any.
Those acute events do occur, but they tend
yes.
to be right after injection.
Yes,
but
that's exactly
long-term,
right.
Not really. Okay.
Yeah, and getting the illness itself has a higher risk.
Absolutely.
Of if you survive, and really any illness, but particularly viral illnesses, they can have some serious long-term consequences for people that you think, okay, I'm going to get sick and then I'm going to get better. But especially viral diseases, they can cause very inappropriate, it's your immune system not functioning properly. And
even if someone completely recovers and feels good, those consequences can show up later on in life, right? Exactly. So the risk, right. So, and in point of fact, I think it's important to point out that we don't know what potential long-term consequences there are to this vaccine, because as people point out, it is new, but there is no, from my perspective, there's no cause for concern, right? We explained what mRNA is. Our cells make mRNA. It's not sort of this foreign substance. One question that I did get is what happens to that mRNA molecule once it's been essentially translated, once it's been used to make the spike protein. Well, it's kind of like that tattered recipe for the ice cream flavor, right? It gets recycled. It actually breaks down. The RNA molecule is pretty delicate, and it gets sort of chewed up and recycled.
Mm-hmm.
And the other vaccine components are simply not a cause for concern in terms of long-term effects.
Correct.
Okay.
Correct.
Versus potential long-term consequences of getting the virus, even if people, survive and recover completely from it.
Correct.
That's an important thing to keep in mind.
That's an important thing. Yes. Yes.
All right.
So there are some definitely some short-term consequences.
Right.
It does cause in about, they say about 10% of people, it really, causes it swells and you get
Right.
a little feverish and you don't feel good.
Right.
And that is actually a normal immune response.
A normal and appropriate immune response.
It's normal, right? So
just means your body's doing what it's supposed to.
It's inflammation, and inflammation is the first step towards long-term immunity. So that is a not an unusual thing to see, and very rarely, I think now we've had not very many. Some people they get a heightened allergic response.
Right. I think we were going to talk about those adverse events in a separate video, right?
Yeah.
Potentially.
And it's very occasional, and
it's super rare. I've only heard of 4 of them at this point from the Pfizer vaccine. So, okay. So it sounds like you're not particularly concerned about the long-term effects. Neither am I. This concern came wrapped up inside of another concern, which was the speed at which the vaccine was developed. And I completely understand that, right? When you have a vaccine that on average, vaccines take 10 to 15 years to develop. And then you've got one that goes from, 0 to in people's arms in about 9 months. I can totally understand why that would cause some concern. But that's another sort of big one. And we're going to tackle that in a different video. So thank you so much for your time this
morning. You're welcome.
Take care, everyone. Bye.
Okay. Bye-bye.